Welcome to Lesson 3.2, our lecture on health and development. The core part of this lecture is to explore the connections between health, education, productivity, and earnings. So I want to start by briefly touching on the link between health and the economy. And the textbook goes into 5 key areas that you need to think about with respect to this. So first of all, health is considered to be a really important contributor to an individual's ability to be productive. And so if you're healthy, you can be productive. So that's number one. Number two is that your health status is a major determinant of whether you're enrolled in school, whether you are successful in school, and really the end point is it contributes to your final future earnings, your ability to go to school and be educated. Number three would be if we think about healthcare costs, for the majority of individuals who don't live in a society like Canada, individual healthcare costs are very high. And so if individuals don't have the financial status to pay for these healthcare costs, it can lead them to be not healthy and also lead them into poverty if they do have the money and all their money is going to their healthcare costs. Fourth, if we think about the country's healthcare cost and we look at the GDP or the amount of money that goes towards healthcare cost, healthcare is a really big national expenditure. And if a country can keep their individuals or the people that live in the country healthy, then they can decrease their healthcare costs. And the last thing which we'll touch on in the lesson 3.3 is equity and health. And that the approach that different countries take to financing and carrying out health services raises importance of equity and inequality between countries and among countries. To me, I like this basic circle about the poverty cycle. So if you start up here, a child grows up in poverty, is significantly disadvantaged in going to school, maybe needs to stay at home and work, or maybe suffers from malnutrition, not enough money, and just can't be successful in school. That individual maybe struggles to get a job, fails to escape the poverty cycle, and ends up having a family that could be in poverty as well. And the cycle goes around and around and around. So let's start off here by talking about health and education. So essentially, health and education are connected in 3 ways. First, the intergenerational links. Second, malnutrition. And lastly, education. Let's start off by looking at first intergenerational links, the health and education of parents and how it affects the health and education of their children. So I've seen the global impact of HIV and AIDS in the communities that I work with in northern Ghana. So the global AIDS epidemic, it illustrated how the poor health of one generation can affect the schooling prospects and the future earnings of the next generation. So we've seen mothers who have died of HIV/AIDS, and the children that are left behind often tend to be poorly fed, malnourished, and often result in ill health. And as a result, they're less likely to attend school and perform well in school. We've also seen times where if a mother is just sick with HIV or AIDS, it's likely that one or more of her children, especially the older daughter, will stay out of school to attend to the mother's health and the chores because the mother is no longer able to do that. Malnutrition and disease can affect children's cognitive development and school performance. And I've seen this with the number of children that I see with malaria. So first, sometimes parents will hold back in enrolling a sick or malnourished child in school. I've also seen where a child, due to malaria or dehydration, will have a reduced attendance at school. They find it hard to concentrate in school, and then so therefore their performance is decreased. Malnutrition can also decrease their cognitive development and ability to perform well in school. So there's a lot of areas that you can see the connection between malnutrition and education. And so if children are not able to learn well in school, it decreases their number of years in schooling, and therefore it reduces their future earnings and the ability to get out of poverty. Number three is all about the connection between health and education. If individuals are educated, they tend to be healthier. But what I want to talk about here is the strong correlation between the female mother education and the health of the mother's children. And so there's a strong predictor that if a mother is educated, that the children will be healthy. So for example, the higher the level of education of a mother in a low or middle income country, the more likely she will immunize her children. And you can see this right here. And so in countries where there were no education, you can see that the immunization rates were lower as compared to higher education. Studies have also shown that a mother who is educated, that the mortality of her children under the age of 5 will decrease. And as well, mothers that are educated will ensure that her children will be educated. So a very strong correlation. And I'm seeing this more and more in Ghana, where a lot more younger girls are being sent to school. When I first started working in Ghana about 10 years ago, very rarely would we see young girls in school, and we're seeing quite a change in that. So this is just a picture from your textbook showing that the health and education of women. So there's been great progress in enrolling children in primary education, even in low-income countries. And this is one of the Sustainable Development Goals that is looking specifically about the enrollment of young girls in school. So this is an easy correlation to understand: health, productivity, and earnings. So we know good health increases longevity and lifetime earnings. Healthy workers are more productive than unhealthy workers. And when ill, many people cannot work and therefore cannot earn money. So the importance of being healthy, to be productive, to be able to make an earning. This is something that I've seen loud and clear in Ghana. This correlation between health, the costs of illness, and poverty. So what we're talking about here is the cost of being ill to an individual and their family, and it can be very high. And oftentimes it causes family to lose or dispose of any assets that they already have, and it causes them to fall into poverty or more likely to stay in poverty. So when people become ill in poor countries, or even in our vulnerable populations in Canada, what happens is illness leads to a decrease in earnings because they can't work. Sometimes individuals will seek health care and often seek out care of different types because that's what they can afford. They frequently have to pay for treatment and for drugs, and these costs can be significant. So again, think about the importance of universal health care. And in order to achieve global health, that is something that we need for all. Think about the indirect costs for illness, and so transportation costs. And then lastly, even thinking beyond the cost of either your short-term or chronic illness, think about the long-lasting disabilities that require considerable costs for health services. And I see this with my population with malaria, the chronic malaria that really has a high healthcare cost. But there's one situation that I want to discuss with you. We were involved in a case where a young father brought his adolescent son to our clinic. He had an overwhelming gangrenous foot from a wound he sustained on the farm. He needed an amputation, and this was going to cost the family significant amount of money, which they were so poor, they didn't have the money. And so what the father decided to do is take this poor boy home and let him die at home because they didn't have the money to pay for this procedure. And even if they did have the money to pay for the procedure, it would have left this child disabled. And the father didn't, he needed this son to be able to help him on the farm. And it's almost like the fittest will survive. And so they didn't have the money to pay for the operation. Even if they did have the operation, they wouldn't be able to buy a prosthesis. This young man would not be productive in the family. And so this poor young boy was brought home and he was going to die at home. So the main messages from this lesson are education and health are closely linked. We see that good health encourages school enrollment, and education is associated with better health practices, especially if a mother is educated. Health is strongly associated with productivity and earnings. Healthier people can work harder, more hours, and longer over a lifetime, and that there's direct and indirect costs to people to obtain health services, which can push them into poverty or keep them in poverty. So next, we're going to move on to health disparities.